Good morning and thanks for joining us on this edition of Impact, reaching you live on ITV. I am Francisca OGAR. Today on Impact, we will be taking a look at how our attitude has changed towards the new normal. In a couple of months back, it was customary for you to find at least 8 out of 10 persons putting on their nose masks, be it the correct ones, be it rightly worn or not, but there was some effort to comply with COVID protocol. The same thing with public places. If you went to a bank premises, you would find water to wash your hands, you would find somebody taking your temperature. Even after that, you would find people offering you sanitizers and all of that. But sadly, a lot of this has changed. In most places, it now appears that there has been a certificate to say there's no more COVID. So you just go about your duties the way you like. On Saturday, I was privileged to be at a massive walk against malaria. And to my surprise, 98% of the people there had no masks on. There was no social distancing. There was nothing at all to show that COVID is still around. It's on this note I decided to bring on the program today a public health expert, Mr. Daniel Gambo. Together we will be taking a look at the implication of having abandoned public protocol on public health. You're welcome on the program, sir.
Thank you.
So you were here during the preamble, but I want your own honest opinion. Having gone around, having been around, how would you say Nigerians especially are faring, with keeping COVID protocols?
I think that, we have returned to the old normal. We are no more in the new normal. And it is very, very dangerous for one who understands about pandemics. Because I thought when COVID came, and we are introduced into the protocol of hand washing, physical distancing, wearing of face mask. Just like before we got adopted to the use of seat belts. Now if you enter your car, your consciousness goes to, I have to put my seat belt. I thought that at this stage where we are now, would have adapted seamlessly the protocol of hand washing. Wherever you are, you want to be conscious that you must have touched something that could infect you, and you want to wash your hand first before you do any other thing. 2, you want to ensure that where you are, that at least when you don't know the person, you create a physical distance of at least 1 meter, 1.5 meter away from that person. You don't know him, you don't know where he's coming from. If you know the person, you want to embrace, you want to hug, you want to handshake, but you be conscious that let me have some social distance between me and this very known, loving person, all right? Because I don't know where he's coming from. He doesn't know where I'm coming. Because it is not you being infected, but you also infecting the other person by not observing the protocol. So we have now gone back to that old normal of doing things unconsciously, that the virus is still very much around, spreading like wildfire in other countries. If we are fortunate that our index is declining, all right, maybe it's because most of us don't go for tests. If all of us today will go for tests, you will see that the infected index will be higher than what it is now. So, and then maybe some of us are immune, just like the HIV/AIDS virus. Some people are carriers. Okay. So also with the coronavirus, COVID-19, some are just carriers. They have it, but because their immunity is strong, they don't display the symptoms, but they can propagate it. They can infect others with it. So honestly, we have abandoned the protocol, and it is very, very dangerous.
Okay, having said that, what do you think is responsible for this current attitude? What has happened to trigger this total disregard for adherence to COVID protocol?
Is the way we approached it from the beginning. Anything you want to do, the foundation, it's very, very important. Have we adequately sensitized the people fairly, not caused panic. We approached it panic. We locked down the nation when we never got to the level of locking down the nation. I'm saying this from an expert who have developed one of those who developed the national pandemic response plan.
Okay.
We were probably in phase 3 of the plan, which we should have watched our borders and caution our nationals, our citizens, on what to do not to get infected. When the virus, we now detect it in Nigeria, then we now introduce the contact tracing mechanism to find out, still keeping the system under surveillance. But we panicked, we sent the people, and we know this is a country where poverty rates higher than even the COVID itself. The people are poor, the people have to go out daily to look for what to eat, all right? Now we lock them in, so created that panic. And so when people discover that, but people are going about, nothing is happening, more especially they believe that, 1, the sickness is for those who travel overseas, 2, the sickness is of the rich, 3, the sickness is, is for the white man, those things that first came, the information. Then the next thing is the social media went agog with various kinds of messaging that really are negative to put the mindset of the reader or the hearer into the perspective that, look, this is real and I can be affected, my family can be affected, and so if my child brings it home, I get infected by it, and if I go, I bring it back home, I infect my wife with it. So if that thing was made properly clear for the people to understand and grow, that knowledge of the impact of the virus, how you can get it and how you can avoid infecting others or being infected, do it in a subtle way. That would, like the seat belt, like I told you, would have cut up the fever of hand washing and all this. But the way we panic and the people discover that, okay, we are not doing it and nothing is happening. So everywhere you go now, in churches, because I know immediately after the lockdown, some churches stop you at the entrance until you have a face mask. Some mosques stop you until you have a face, and then there are sanitizer at the entry points in our shopping malls and all this. But these things have all now
fizzling out.
They are fizzled, not even fizzling, because in most people don't even give a damn again. But it is dangerous. Okay. We are calling on all Nigerians, please, let's go back to the new normal. When the whistle is blown, that yes, the 90% of the population of Nigeria are vaccinated, all right, and so everybody is safe. But let me tell you also, despite the fact that you are vaccinated, I'm vaccinated, I still don't avoid the protocol.
I was going to come to that because I noticed especially that the relaxation really became more serious after the vaccine came to Nigeria. It would appear that some of the people responsible for enforcing, this is not to accuse anybody, but it would appear that some of the people responsible for enforcing the protocols, as soon as they themselves were privileged to get vaccinated and had seen a number of people vaccinated, they felt free to drop the enforcement. So is that to say that having been vaccinated, kind of gives you the right, to violate COVID protocol, or that you are no longer able to spread the virus?
What? Being vaccinated doesn't stop you from getting infected.
Wow.
But that your immunity is able to overcome the impact of the virus on you. But that doesn't stop you from spreading the virus to some other person.
Okay.
Because you now become a carrier. Since you are immune, you are immunized, the other person is not immunized. So he gets contacted, all right, and get infected. Okay,
is that to say, sorry, for clarity, if I come in contact with the virus, I pick it up.
Yes.
So I have the virus in me, and I'm able to spread the virus to people around me without getting sick.
Sick yourself, personally becoming sick. because you are now immunized. This is what the immunization does. It protects you. It doesn't protect your environment. All right? It stops you from, it doesn't stop you from getting it from the environment, but it stops, and it doesn't stop you from spreading it to the environment, but it stops you from being sick. Right? So, and it is not generally that you get it through droplets. Hands, because you still now are off guard. You now use your hand carelessly without minding to wash it whenever you touch surfaces that could be infected. All right? So things like that.
Okay. So now, having looked at all that, what are the dangers of carrying on in this way? So far, it would appear we are fine. We have been disregarding protocols for a couple of weeks or months now, and yet the indices or the index for affected persons seems to be going down. Now, if we sustain this attitude, what could happen further down the line? Well,
one, we have to increase our surveillance. We have to increase our contact tracing mechanism. For everyone that is infected, who have you interacted with, all right, within the family and those known. And then from that, we now increase our testing capacity. We must continue along that line. Just like we still do with the HIV, just like we will do today with Ebola, all right, so we should continue with coronavirus. We cannot run away from it. In fact, we have to learn to live with the virus now, because we cannot eliminate the virus. All right, it keeps mutating, changing from one state to another state, from maybe a less volatile state to a higher volatile state, from a lesser killing virus to a high, potent virus that you get it and you get, you die. So we have to increase our contact surveillance, then contact tracing, testing. Those things we have to increase, and then encourage people to be vaccinated.
Okay.
I believe that will help us maybe in the near future go back to the old normal, but for now, let's please imbibe this.
Talking about encouraging people to be vaccinated, you have taken the vaccine, I have taken the vaccine, but I don't want to share my personal opinion here because it doesn't count. Now, as a person who took the vaccine, have you noticed any abnormalities about yourself since you got vaccinated?
Generally, with all vaccines, all yellow fever, I think hepatitis, and then because I've had all these vaccines, vaccinations. So once the day you get it, it depends on your own personal immunity first. You may have temperature, weakness, right? Some people say it didn't cause them to sleep, right? You could have mild swelling at the point of impact. It's nothing. It's just normal. It's normal. It's nothing to panic, nothing to fear about. Yes, there are adverse effects. Those people who are allergic to certain chemical when introduced into them. All you need to do is, when you have those allergies or adverse effect, is to meet your doctor. I just took my coronavirus vaccination, and this is what I'm seeing. I'm seeing rashes. It could be coincidental. It may not be the vaccine may not be the cause. It could be coincidental that you are vaccinated. Even if you are not vaccinated, tomorrow you will still have the rashes coming up on you. So you need to see your doctor to be able to explain to him, and the doctor will properly advise you. If there's a need to monitor you, that is why whenever you are given the vaccine, you are asked to wait for the first 15-30 minutes to see how you react to it, and then you go. So for me, yes, of course, I was a bit dizzy. I drove after the vaccination. I drove home. And then what I did was to just go to sleep. Okay. And then I refused to take any other medication prior and after. Okay. No, I refused.
But you didn't grow horns, you didn't see a tail coming out of you.
No, there were no horns, no tails. I never had nightmares. I never even dreamt that I had. And in fact, what I even do, or I did, to be able to encourage people was, first thing is the morning I went to the gym.
Okay.
All right, and I took
pictures,
a video, and I put it on Facebook. I had it yesterday. I took the picture when I was taking it. I took the picture when I was in the gym. The next day I was in church. I took the picture when I was in church. So, I mean, it's just normal that people should understand. Remove the fear. Get yourself immunized so that you will be able to protect yourself and stay alive to look after. I'm not saying protect yourself and don't protect your. No, if your your family is not vaccinated, you can bring it and kill them. But stay alive to take care of your family.
Okay. All right. Now, early this year, there were indications that we were in the second phase of COVID-19. So, would you say that we are out of it now?
No, we are still in the second phase, because if we look at the number that at the kind of virus, the second phase actually is the type. All right, it is not the first type, the type 1. We are now being infected by the type 2 of the virus. Okay, so this type 2, we're told, is more violent. And if you look at, immediately we went into the second phase, there was an upward graph, upward,
like a surge.
Yes, like a surge. All right, and as people started getting vaccinated, especially those that have been infected, now we see now the thing is gradually coming down. Okay, but that doesn't mean that we are out of the second phase. We are still within the second phase.
All right. On a general note, what message do you have for Nigerians as a whole?
First, to the government, please, let's review our pandemic plans. Let's look at them holistically, see what we have done right and what we have not done right, and put back the documents. Ensure that all agencies, both old and new, are now introduced, and let us rehearse, simulate this plan to ensure that every agency knows what to do and how to do it, and has the capability of doing it. Because it is one thing to know how to do it, and you don't have what to do it with. So government has to be on its toes to ensure that our plans, but the pandemic plans, we have the influenza, and then we have the Ebola pandemic plan. All right, let us bring all those plans together and see how we bring them into as one document that will respond to pandemics in Nigeria. That is to the government. And then always let us, to the government also, let us have resource, because during pandemic, mobilization of these resources becomes very hectic. Okay. So let us have a kind of a back storage of resource that we will require in the event of pandemics. See how we went looking for ventilators. If we had not been helped, what would have happened? All right. But if we look at the different treatment protocols, and then we make sure that we have a good number of the resource, stored, that will help. We will not be panicking. All right. Now, to the people, let us be obedient to constituted authorities. Let us not just start spreading what we don't know, what we hear. Let us listen to government. What government is telling us. I wonder, why will government bring vaccine and say it is for her frontline workers, soldiers, medical staff, firefighters? And so why will the government want to kill those people that are really to defend her national integrity? Why? Yeah. So the people should understand, government will not want to eliminate those set of people. And they said, okay, now the first line people to take that vaccine were the people in the highest authority in the land. Nobody will. Don't believe what people say that maybe they were not getting, the one they are being given is not the same one that, no. I mean, so what? Who wants to live forever?
Oh, yeah.
All right? So if they don't take the one that you are going to be given, assume, do you want to live forever? Take the one that they give you so that you die and leave the world for them to live forever.
All right.
But I don't think anybody will want to kill its best hands.
And survive on what?
And for what? So please, I want people to listen to government. Don't listen to people. Listen to government.
Okay.
Go for this. Whatever the government says, this is it. It is for the good of the nation. Remember, when the chips are down, it is the government that pays. Because I mean, it is our national treasury that is depleted in trying to. When people were going for palliatives, this thing was not coming from heaven like manna.
Yes.
It is our treasury that was being depleted to provide food for people. But if people had abided by the protocol, they would have gone about doing their normal business. The government doesn't have any concern about looking for palliatives to give you food in your house while you are sleeping.
All right, sir. I must say thank you so much. In fact, we could go on and on, but the important thing is Nigerians should listen that there is still COVID and we still need to be careful. Thank you for coming on the program.
You're welcome.
And for you, my viewer out there, thanks so much for having invested your time with us. I do hope that you've learned a thing or two. I do hope that you would disregard the information going around that we are out of COVID and continue to do what we must do to keep ourselves and our loved ones safe. Let's do this again, same time next week, same station. My guest has been Mr. Daniel Gambo. I am Francisca OGAR. Thanks for watching.